Hi, Stacey Garish here from Training for Transformation, and today we've taken to the street once again, so this is street interview number 3, and today we've actually gone and knocked on the door of the Berris Burgoyne Naturopathy Clinic, and I have the lady behind here, and this is Berris Burgoyne herself. So Berris, thank you so much for allowing us to interview you today.
No problem, Stacey.
Can you tell us a little bit about yourself, please?
Well, I'm a naturopath and I've been in clinical practice for about 21 years, so a long time, and I love what I do. Fantastic.
Yeah. Okay. So, all right. So, other than being in practice for 21 years, that's a long time. Have you always known that you wanted to be a naturopath?
No, I decided when I was in my mid-30s, early to mid-30s, that I wanted to be a naturopath.
Okay.
I'm giving away my age a little now, but yeah.
I'm sure we'll know. Okay. So yeah. Are you married? Are you single? Are you...
No, I'm single, divorced for a very long time, so I'm single. I have 2 grown-up children and 5 grandchildren.
Wow. Oh my goodness.
Life's good.
Yeah, it would be. Lots of Christmas presents.
Yes.
Lots of good times as well.
Yeah, absolutely. Yeah.
So in your practice, in your naturopathy practice, let me ask you, is communication important?
It's absolutely vital.
What makes it vital?
Well, I need to obtain information from clients.
Mm-hmm.
They need to feel comfortable to give me that information.
Mm-hmm.
And sometimes the information I get doesn't always come just from them verbalising it. You know, there's a lot of other signals that you pick up as well, and I think it's really important to be able to do that so that you can really deliver what the patient needs, basically, and what they're going to accept as well. So it's really important for me to understand what they're telling me, even if they're not always verbalising it.
Yeah.
But it's also important for me to be able to communicate with them so that they understand what I'm asking them and what I'm telling them they could be doing to improve their health, etc.
Okay. All right, so it's a matter of being able to ask very specific questions and very clear questions for that?
Yes,
Yeah.
And to keep the consultation, I guess, on track. So that's very important as well, because we always have a time limit.
Yeah.
So it's really important to try to keep that conversation on track so that I get all the information I need to be able to help the person as best I can.
So it's almost like being a medical doctor then, you know, just
it's very similar. Absolutely. It's very similar from that point of view, absolutely.
So people would actually come with symptoms, but they don't know what the symptoms mean, and then you need to be able to...
That's right, yes. And I need to know what all the symptoms are. Sometimes people won't think something's important, for example, when it is.
Oh!
You know, it just needs to be very specific with the questioning.
So it's almost like some of the time they might say, they come in with stomachache or something and go, what did you have for breakfast? And they go, oh, food.
Well, sometimes.
You go, well, what sort of food? Yeah.
Or I could ask a young woman if she gets any period pain, and she might say, oh, just the usual. It's like, well, what is that for you? Because technically there's no such thing as the usual, you know, so it's really just finding out what their experience is, I think, of their symptoms, of their life. It's not just their symptoms, it's their whole life, because that's going to affect their health. Absolutely.
Oh my goodness. And it was also, have you found that at any time that anyone doesn't, like if people are not understanding, that you need to find another way to communicate something to that person? Or?
I think usually I can do pretty well with it.
Yeah.
Pretty good. Well, it is, I think. I've been doing it for a long time, and you do just tend to pick up signals. You pick up a bit of resistance when it's there. Sometimes you just have to leave things. Okay, then we're not going to do that today. We're not going to go there today. But I think with good communication comes trust as well, and I think that's really important.
Oh, okay. So communication, well, the trust is sort of more the foundation of the communication.
Well, I think it works both ways. If I can communicate well to the patient, then they're going to trust me more. It becomes clearer.
Yeah, definitely.
And the more it's got to be a trusting relationship. If it's not
going to work.
It's not going to work.
No, okay, so very, very much they need to be able to trust you to let you know what all the symptoms are, what the issues are, and then so that you can prescribe the right remedies.
Yeah, absolutely.
That's absolutely vital.
It is. It's really important.
Yeah. So can I ask you, the communication you have at work, is it similar or is it different to the communication you have with your children or your grandchildren?
Oh, that's a very good question. I guess it's different in a way because it's always about different things.
Okay.
And it's a different context, of course. But I think that the skills you learn in one sort of relationship for communication or anything else really get carried across into all other parts of your life anyway.
Yeah.
So, I've learned a lot with dealing with people so closely for so long. So, I think when I'm talking with my grandchildren now, I can also pick up more in their body language, I guess, than maybe I would be able to do without that sort of experience.
Okay, so you rely a little bit on body language as well when you're talking to people?
Absolutely.
How do you do that? Like, how do you know what the body language is saying?
Well, I guess it's an educated guess a lot of the time. I mean, you never know 100%, I suppose. But, I think you can pick up if you're asking somebody about something and they really don't feel comfortable talking about it, but they're not telling you they don't feel comfortable talking about it. And there's some things that I don't necessarily need to know, some things I don't need to know right then. So then I can just leave that and, maybe we can come back to it later. When more trust is developed, really.
Yeah. Okay, so that's very important, and that's part of having a really good communication skills is being able to read body language.
Oh, I think so. Absolutely.
Yep.
Absolutely.
Okay.
Yeah.
So that would be the same then with the kids, like if they're trying to pull the wool over.
Yes. Not very often anyway.
Oh, look, I'm sure they're really good kids. Occasionally, they've made a mistake or something.
Oh, look, yeah, absolutely. Yes. And I think in some ways kids are easier to read because they're much more innocent. They don't have so much practice on it.
That's really good. So what's the best? Okay, so when you are communicating with either your clients or your kids or anyone else, what would be the most important aspect of communication?
I think the most important aspect, which is something I fall down on quite often, is being very present and actually listening. Like communication is not only about talking and getting your point across, it's also about listening. And I certainly fall down there sometimes. And I think, quite frankly, most people do. A lot of us aren't always very good listeners.
Okay, so the listening would be the most important part then.
Yes.
Yeah?
Yes.
I'm just wondering if a lot of people actually do feel listened to in their life, or whether they're not feeling listened to.
I suppose I can't speak for everybody, but I would guess that most people don't feel listened to. Most people don't feel listened to. Most of the time, I would guess.
Yep.
Really?
Yeah. I think I have a tendency to agree with you on that one as well, Berris. So.
I do a lot of lecturing at the postgraduate level, and I can be speaking to 100, 120, 150, 200 naturopaths sometimes, and I absolutely love it. And one day, 2 years ago, I thought, what is it I like about this? And it occurred to me what I like about it is I have a whole room full of people listening to me. And I thought, gee, that doesn't happen very often in my life, really. I like this. Yes. So it was a very interesting insight for me to realise that that's actually what I liked. Yeah.
I was just thinking, there's some of the time with your patients, you're going to need to see them 2 or 3 times.
Absolutely, yes.
And if you've seen them on the first consultation and you've asked them to go and do something, like do a particular exercise or take a particular medication or something, and they come back to the next session and they haven't done it,
Yes.
can I just ask you, do you feel listened to then? Or it's more...
Look, sometimes it's that I may not feel listened to, but there's all sorts of reasons that people don't comply. Okay. And I would guess, in general again, but I would guess that quite often it's more self-sabotage than not listening.
Yeah, definitely. Which is, again,
I think most of us are very good at that too. I suppose I can only speak for myself again, but, you know.
Oh, absolutely, because I'm sure that almost all of your patients actually do listen and do follow the advice that you do.
Most do, absolutely.
Absolutely, yeah. And because they've actually listened to you and then followed through on all the treatments that you've advised, then they actually do get better and get well.
Yes, that's right.
And that would be a good feeling.
It's a fabulous feeling. It's fantastic. It's lovely to go home at the end of the day and feel like I've made a difference, a positive difference in people's lives. And it's a very nice thing to be able to do, really.
Yeah.
And to earn money at the same time, to earn my living doing that sort of thing. It's fantastic.
Yes. So, let me ask you, if there's the communication skills, is it something that we're actually born with, or is it something that we have to learn along the way?
I think it's something we have to learn. I think if we're born with good communication skills, we'd all have them. And I don't think we do all have them. And I think it's a lifelong chore to be just getting better and better at it. I think we learn it from our parents, from people around us, our teachers, all sorts of things as we're growing up, just quite innately. But, you know, I think a lot of us also have to be more proactive about learning to communicate well when we're adults. And I've certainly done courses, not on communication skills per se, but, you know, psychology type courses and workshops and things that have helped me to get a better grasp of all of that. Yeah. So I don't think it is something you're born with.
I actually think you hit the nail on the head though. I think, it's a skill that we do learn, but I think we also pick it up from those around us as well.
Oh, absolutely.
And if we find that we're not getting the results that we want, then we need to go and look at some formal training.
And I think if you're a child with parents who communicate well to each other and communicate well with you and allow you also to communicate, and I think, you know, child rearing has changed a lot from when I was a child.
Yes.
You know, I think children are able to be more expressive and are listened to more now than in my generation. And so, you know, I think if you grow up with that, then you do learn to be a better communicator because that's just how life is. But that not everybody is lucky enough to have that. And that may not always be enough either.
So a lot of the time it's the environment. So if the environment is a place of safety and trust, where the child can feel okay about asking questions or feel okay about saying, hey, I made a mistake, can you help me out?
Yes, absolutely.
Yeah. And then there's the other environments as well.
Yes.
So if they don't feel safe, then they're not going to ask their questions and learn about the world, or they're not going to say, hey, I've made a mistake here, or they're going to try and cover it up.
Or they're not going to express their feelings. They're not going to feel okay to express how they're feeling. Yeah.
Interesting. So different environments can create different communication experiences as well.
Oh, sure.
For people.
Yes.
All right. So if there was one thing that you would like to say to everyone out there, and what would that be in terms of communication?
I think it would be practice listening.
Practice listening?
Practice listening. Just very consciously when you're having a conversation with somebody, practice actually listening and be 100% present and listening to what they're saying, not be thinking about what you're going to say next, which I think happens a lot. I'm certainly guilty of that a lot. So, or not thinking about all sorts of other things. Just really, and I think it takes practice. It takes practice, absolutely.
Okay, thank you so very much. Berris, thank you for allowing me to come and interview you.
You're very welcome.
I'm loving your message. And you've heard it, everyone, that communication is a skill that sometimes we need to go and learn. And some of the time it's the environment that we actually grow up in that makes the difference to whether we have really good communication or whether we don't. So I'm Stacey Hewish, and this is Berris Burgoyne, and this is Street Interview number three. So until the next one, bye.
Okay, Stacey, can I just say one more thing here? I'm a little bit hesitant about saying this,
Okay.
so I don't want to be sort of too inflammatory. However, we're living in a world of lots of terrorism, and I believe, and I am not one minute condone terrorist activities. I think they're horrendous. However, I think that a lot of terrorism is born out of people not being listened to or not feeling that they're being listened to, and that is last resort. And the world terrorism that we're seeing now is a huge example of that. But I also think we can see it in our everyday lives. You know, someone that walks into a room full of their friends and makes a statement about somebody upset me and I'm leaving now or something. In a sense, that's a terrorist attack. Anywhere where it's kind of in, upset everything and out again is an act of terrorism. So we see that all the time in our daily lives, really.
Yes.
And I think what we see on the world stage is just, a big example of that, and a hideous example, really. But, we need to learn to listen. Doesn't mean everybody needs to get what they want, and I think people are okay with that. I think what people want is to be listened to and acknowledged. Their needs to be acknowledged, even if they don't get everything that they want. And you remember the war on the Opera House, no war on the Opera House?
Yes.
I think that was a really good example of what I'm talking about. And an interview, I can't remember the guys' names who did that, but I, for one, say good on you personally. And they, in an interview, they were saying that the reason they did it was that just previous to that, 100 or 150,000 people marched in Sydney against us going to the war in Iraq. And the Prime Minister of the day,
the Prime Minister of the day,
John Howard. I guess you forget John Howard. Yes, John Howard referred to that whole 100,000, 150,000 everyday Australians as the rebel. And these guys said, what do you do then when the Prime Minister refers to that group of people as the rabble? No one's listening. No one's listening to the statement that was being made by those people. It's being totally dismissed. So they felt they had to do something that really made someone listen, and they did. And that deed was, a lot of people were down on them because it was in Opera House and it's such an icon for Australia. But it got noticed and it got someone to listen to what they were saying.
Isn't that very interesting? And I think you hit something right on the head here, Berris. And that is that people who are not feeling listened to then resort to other methods of making others feel, others listening to them.
That's right.
And they will do it in the only way they know how to do it.
That's right. And it's not always productive.
No, but at the end of the day,
they feel like they have to do something.
They have to do something. They're not feeling listened to, consciously, and then they go, well, that's it. I'm going to make people listen to me, and they go and paint no war on the side of the Opera House, or they go and do what they're going to go and do.
And I would actually challenge everybody to just look at their own behaviour throughout the day and see, where am I doing that? Because I've got no doubt we all do it, because most of us don't feel listened to a lot of the time. So I would challenge everybody, what sort of behaviours do you exhibit in order to be listened to? or do you try and get what you want when you're not getting it?
Oh,
You know, we can solve, we can throw things, we can, you know, we can not talk to somebody for 2 weeks. There's all sorts of things.
Absolutely.
Well, there's all sorts of things that people do. We all do it. We all do it.
Berris, I'm actually going to ask everyone to actually take you up on this challenge. So everyone out there, I want you to take up Berris's challenge right now. And I really do want you to go and look at your own life and look at all the behaviours that you do when you're not feeling listened to. What do you do to make yourself feel listened to by all those other people out there?
And I'm not saying any of those behaviours are bad.
No,
It's just we do things if we're not being listened to or don't feel like we're being listened to. We do things to try and get listened to.
Absolutely.
Simple as that.
I'm so glad you've done this little tiny PS. Awesome. So yes, you can. Okay. Thank you so very much.
Thank you.
Okay, well this time we'll actually say goodbye to you. Thank you guys for listening. Bye.